My name's Fiona Powell. I'm a neuro physio and I work 1 day a week with the MND team. I think my role mainly to keep people as mobile as possible for as long as possible and to keep them as independent as possible. So much of my work involves giving people exercise advice, postural advice, and working with orthotics to give people maybe some collars for extra support and some leg braces. We probably all look at postural support for patients, so it might be whether they're sitting in an armchair or whether they're going to be sitting in an electric wheelchair. Having the right sitting posture is great for people to be able to stand up and walk. So a lot of our things are very interconnected. If somebody doesn't have a good chair, they get tired quicker. If they get tired quicker, they might not be able to eat as well. My role makes a difference to families because the aim is to get the best quality of life for somebody and be able to try and enable them to do the things that they want to do most. So it's usually quite personal. To have a new motor neuron disease centre, I think would make a huge difference, because what we have to look at is the facilities we have now for patients. We have poor privacy, we have totally inadequate toileting facilities. Patients choose not to have a drink before they come because it's difficult to go to the toilet when they get here. We have small treatment rooms that aren't big enough for a member of the family or somebody in a wheelchair. We have quite a long distance for them to get from their car to the clinic. There's a huge amount of things that make it very difficult for a patient. To have somewhere that was actually clinically set up for patients would make so much difference to make it less stressful for them and less tiring, because fatigue is a massive problem for MND. From a physio point of view, for them to be able to try a chair, a riser recliner chair, to see how the ease of standing up within the clinic, and these type of different bits of equipment for them to try probably just before they do need them, would mean that we could get the right equipment in at the right time for patients.